solve the cost issue? You know, I was involved like in the Choosing Wisely guidelines, you know, an educational endeavor. There are other things out there. What do you think we can do to make some headway in solving this problem?
If we follow the trends and if there is more out-of-pocket spending, the patients are definitely going to have to get more engaged in the discussion. As consumers of health resources, they're going to have to make decisions, which is not always a fortunate situation to be in, but I know that there's other things like patient assistance programs and foundation support that are out there. I think that in terms of addressing this, there are many natural market mechanisms, such as genericization after loss of exclusivity. Biosimilar legislation is finally making headway as it's entering the United States, which is essentially meaning those big complex drugs that you have to take by infusion, finally there's going to be copies after they lose protection. And so we should start to see some erosion of the price of these therapeutics, but that doesn't address the big picture and cost of care. There's a lot of initiatives going on right now looking at innovative payment models for a variety of cancer care, including bundled payments, accountable care organizations, et cetera. So I think as we continue to see this evolve, we're going to see some good things and some bad things, and it's about navigating that with the physician and the patient.
Well, I think we can do better. You know, and I think one way we can do better is by making sure that we integrate the patient preferences. There are many different approaches to doing this, and sort of stated preference methodologies. But there are ways in which we can really be asking patients systematically about the kinds of trade-offs they would make, so that we can take into consideration in what kinds of treatments are being developed, what's coming to market, and what's available to them.
I think we need to build upon the success we've had in reducing the rate of increase of healthcare spending, which is slowing. You know, everywhere around the world it's going up. Our rate of increase is going down because we use new medicines and new techniques faster. I think we need to speed the plow. We need to reduce the antiquated clinical trial system, allow people who want to take risk to do risk on their terms. And secondly, I think the personalized medicine, we need an app so that people who have a problem or are diagnosed, God forbid, with something, can use a cloud to find out what works best for them, what works best for other people in their group, and use that information to get the right treatment first time, every time.
There are groups like that, like
Patients Like Me,
yeah, who's already aggregating information and providing a wealth of information.
We approach your question, Diane, with the goal of thinking about improving quality care for every patient. I think one of the things that takes into consideration everything my fellow panelists have brought up this morning is the concept of cancer care planning, and that's something we haven't spoken about in-depthly this morning. But I don't think any of us need to read another IOM report to indicate the benefits of cancer care planning, both in terms of end results for individual patients, in terms of accessing the appropriate treatment for them, evidence-based medicine. But I think the result we've also seen with the utilization of cancer care plans is an overall reduction in cost for therapies for individual patients. Congresswoman Lois Capps has introduced, for what now, Brian, the last 5 Congresses, an excellent piece of legislation which would create a reimbursement mechanism for cancer care planning. And I think cancer care planning for every patient could be an important first step in ensuring that critical conversation between patients and their healthcare providers about the course of their treatment, about the value of their treatment, about the cost of their treatment, while also impacting the value, the cost, and the overall challenges we've spoken about this morning in terms of the overall healthcare system.
This is the reason why I joined LLS almost 3 years ago, to spearhead the efforts to address patients' financial toxicities and provide better access. 3 things that we are and can be doing better. One is define the scope of the problem. I mentioned a research study to empirically examine the perspectives of patients and providers. Also looking at the impact of specialty tiers, for example, on insurers, on their actuarial value. Is it really burdensome to put a $100 or $150 cap on a specialty tier drug? And the answer is no, it's not across their membership. 2 is to actually advocate for patients and have patients' voices heard on these issues. So whether it's specialty tiers, whether it's providing parity among different types of provided cancer therapies, make sure that the patient's voice is heard across the nation, and we can build networks of advocates who can empower or can educate and inform decision makers. And thirdly, we can provide financial assistance, and we do, whether it's copay assistance or premium assistance or travel assistance or even just education and information so that patients can feel like I can make the correct decision, I can make the decision in my best interest.